I'm Joe Simone, president of Simone Development Companies. I am proud to serve as a volunteer leader of the American Heart Association's Heart of New York City campaign. Welcome to the first ever Heart of Innovation video series. Simone Development Companies is thrilled to support the association and sponsor this series that brings science to life by highlighting research that impacts the lives of everyone who lives, works, and plays in New York City. Science is a pillar upon which the American Heart Association was founded in 1924, and it will always be part of the association's ongoing legacy. Did you know that the American Heart Association has invested $5 billion in scientific research since 1949 and now invests close to $500 million annually? Funding research is a cornerstone of the American Heart Association's life-saving mission, and that starts by supporting young researchers as they begin their careers in science. Part 3 of the Heart of Innovation series highlights local researchers who received American Heart Association funding in the early part of their careers. We'll learn how that initial support made all the difference in their work. And now it's my pleasure to introduce you to the researchers who bring science to life.
In 2016, the American Heart Association announced a call for applications for strategically focused research networks in the specific area of obesity. So this fit us perfectly because we had already been, gathering researchers with similar research ideas.
During my graduate training, I did a lot of laboratory-based, very highly controlled experimental work with maybe not so much generalizability to the community. The scientist development grant allowed me to sort of change gears and work on a project in a clinical population.
I started in clinical training, and because of the interest in genetics of sudden death, this was a field, especially 20 years ago or so, that was very connected to research because we didn't know enough. We were discovering new genes and trying to really dissect the conditions and bringing them from sudden death genetically caused to different disease names and different features. Nowadays, we have enough new instruments in the field of basic research that will allow us to really change the course of these diseases.
I personally, and most of my colleagues in the sleep community, were thrilled when the American Heart Association added sleep as a critical component of optimal cardiovascular health. So we were really excited about this because now we're seeing a translation of this work into public policy.
You are always discovering something, is always engaging, so you feel that you are never done. And once you accomplish one discovery, there is a new door that opens, and the next task and the next challenge is there for you.
For giving us that opportunity to formalize that interaction, I always say that I will be forever grateful to the American Heart.